Sleep apnea is a sleep disorder characterized by pauses in breathing or shallow breaths during sleep. These interruptions in breathing can occur multiple times throughout the night, disrupting the normal sleep cycle and reducing oxygen flow to vital organs. Sleep apnea is classified into several types, each with unique characteristics and underlying causes. Types of sleep apnea: obstructive sleep apnea, OSA. This is the most common form of sleep apnea, accounting for around 84% of cases. OSA occurs when the muscles in the throat relax excessively during sleep, causing the airway to become partially or entirely blocked. This obstruction leads to repeated pauses, apneas, or shallow breathing, hypopneas, that disrupt sleep. Central sleep apnea, CSA. Unlike OSA, central sleep apnea occurs when the brain fails to signal the muscles responsible for breathing. This results in a lack of effort to breathe during sleep, leading to pauses in breathing. CSA is less common than OSA and is often associated with underlying medical conditions, such as heart failure or stroke. Mixed sleep apnea, also known as complex sleep apnea. Mixed sleep apnea combines obstructive and central sleep apnea. Individuals with mixed sleep apnea initially exhibit characteristics of OSA, but the condition may evolve to include central sleep apnea over time. Welcome back. Today we're focusing on sleep apnea relief. Can exercise really be a cure? Before we get started, make sure to hit that subscribe button and notification bell for more health tips. The link between exercise and sleep apnea. Sleep apnea is a complex sleep disorder that can be influenced by various lifestyle factors, including physical activity levels. Research has shown a clear link between exercise and improvements in sleep apnea symptoms, making regular physical activity a valuable component of comprehensive treatment strategies. Exercise addresses sleep apnea by targeting several contributing factors, including weight management, muscle tone, and cardiovascular health. Individuals who exercise regularly often experience reductions in sleep apnea, severity, and symptoms, leading to better sleep quality and overall well-being. Common symptoms of sleep apnea: loud snoring. One of the hallmark symptoms of sleep apnea is loud and persistent snoring. The sound occurs due to airway obstruction, causing vibrations in the throat tissues during breathing. Gasping for air or choking. Sleep apnea episodes may be accompanied by gasping for air or choking sensations as the body struggles to resume normal breathing after an apneic event. Daytime fatigue and sleepiness. Sleep disruptions caused by sleep apnea lead to poor sleep quality, resulting in excessive daytime sleepiness, fatigue, and difficulty concentrating. Morning headaches. Waking up with headaches, especially in the morning, is common among individuals with sleep apnea due to fluctuations in oxygen levels during the night. Dry mouth or sore throat. Mouth breathing during sleep can cause dry mouth or a sore throat upon waking, indicating airway obstruction during sleep. Restless sleep. People with sleep apnea may experience restless sleep, frequent awakenings, or tossing and turning throughout the night. But it's important to note that not everyone with sleep apnea will exhibit all these symptoms. Diagnosis typically involves a sleep study conducted in a specialized sleep center where breathing patterns and sleep disturbances are monitored overnight. Now, here are the benefits of exercise in treating sleep apnea. 1. Weight loss. Obesity is a significant risk factor for obstructive sleep apnea, OSA. Excess weight, particularly around the neck and throat area, can lead to airway obstruction during sleep, resulting in breathing pauses and disrupted sleep patterns. Regular exercise and dietary modifications can facilitate weight loss and reduce the severity of sleep apnea symptoms. Impact of obesity on sleep apnea. Excess adipose tissue in the upper body can compress the airway, narrowing the passage through which air flows during sleep. Fat accumulation around the neck and throat increases the risk of airway collapse, especially during relaxation of the throat muscles during sleep. Obesity-related inflammation and hormonal imbalances can contribute to airway dysfunction and exacerbate sleep apnea. Studies have shown that even modest weight loss, as little as 5 to 10% of total body weight, can significantly improve sleep apnea severity, including reduced snoring, daytime fatigue, and frequency of breathing pauses during sleep. 2. Strengthened upper airway muscles. The tone and strength of upper airway muscles are critical in maintaining airway patency during sleep. Weakness or laxity of these muscles can contribute to airway collapse, particularly in individuals with obstructive sleep apnea. Specific exercises targeting the throat, tongue, and soft palate muscles can help strengthen these muscles and reduce the risk of airway obstruction. Importance of muscle tone in airway health. Stronger upper airway muscles are less prone to collapse during relaxation, thereby reducing the incidence of breathing pauses and snoring. Improved muscle tone can improve airway patency and airflow, facilitating uninterrupted breathing during sleep. Clinical trials have demonstrated the efficacy of oropharyngeal exercises, such as tongue and soft palate exercises, in reducing sleep apnea severity by strengthening upper airway muscles and improving muscle tone. 3. Improved quality of sleep exercise profoundly impacts sleep quality and architecture, promoting more profound, more restorative sleep. By enhancing sleep patterns and promoting relaxation, regular physical activity can mitigate the disruptions caused by sleep apnea and improve overall sleep quality. Role of exercise in enhancing sleep patterns. Exercise helps regulate circadian rhythms, promoting synchronization between the internal body clock and sleep-wake cycles. Physical activity stimulates the release of endorphins and reduces stress hormones, creating a conducive environment for sleep. Improved cardiovascular fitness and respiratory efficiency from exercise contribute to better oxygenation and sleep quality. Studies have shown that individuals who engage in moderate-intensity aerobic exercise experience fewer nighttime awakenings, increased sleep efficiency, and reduced daytime sleepiness. Exercise-induced improvements in sleep quality can alleviate sleep apnea symptoms and enhance overall well-being. 4. Reduce daytime sleepiness. Daytime sleepiness is a common and debilitating symptom of sleep apnea, affecting overall quality of life and daily functioning. The link between sleep apnea and daytime fatigue is multifaceted, involving disruptions in sleep architecture and impaired oxygenation during sleep. Link between sleep apnea and daytime fatigue. Sleep apnea disrupts normal sleep patterns, leading to frequent awakenings, fragmentation, and inadequate restorative sleep. Intermittent blood oxygen levels, hypoxia, drop during apneic episodes, trigger microarousals, and prevent individuals from reaching deep restorative sleep stages. Chronic sleep deprivation due to sleep apnea results in excessive daytime sleepiness, cognitive impairment, and an increased risk of accidents or errors. How exercise helps reduce daytime sleepiness. A meta-analysis published in Sleep Medicine Reviews confirmed the positive effects of exercise on reducing daytime sleepiness in sleep apnea patients. These include: exercise improves overall sleep quality by promoting deeper and more restful sleep. Regular physical activity enhances sleep architecture, increasing the duration of slow-wave sleep, deep sleep, and reducing nighttime awakenings. Physical activity stimulates the release of endorphins and neurotransmitters that promote wakefulness and alertness during the day. Aerobic exercise, in particular, enhances cardiovascular fitness and oxygen utilization, reducing the likelihood of daytime fatigue and improving overall energy levels. 5. Increased energy levels. Exercise is a powerful energy booster that enhances physical fitness, mental acuity, and overall well-being. Regular physical activity improves cardiovascular health, increases oxygen utilization, and enhances metabolic efficiency, contributing to increased energy levels throughout the day. Here's how exercise boosts overall energy. Improved blood circulation. Exercise promotes efficient blood circulation, delivering oxygen and nutrients to muscles and vital organs. Enhanced circulation reduces fatigue and improves stamina, allowing for sustained energy levels during daily activities. Release of endorphins. Physical activity stimulates the release of endorphins, neurotransmitters that act as natural mood elevators and pain relievers. Endorphins promote well-being and increase mental alertness, improving energy levels and motivation. Regulated sleep patterns. Regular exercise helps regulate sleep-wake cycles and promotes deeper, more restorative sleep. Quality sleep is essential for energy restoration and overall vitality. By improving sleep quality, exercise enhances daytime energy levels and cognitive function. 6. Improved mood and mental well-being. Sleep apnea can significantly impact mood and mental well-being due to disrupted sleep patterns, oxygen desaturation, and daytime fatigue. Individuals with untreated sleep apnea often experience mood disturbances, irritability, anxiety, and depression. The chronic sleep deprivation and oxygen deprivation associated with sleep apnea can impair cognitive function, emotional regulation, and overall quality of life. Research has shown that sleep apnea is linked to an increased risk of mood disorders, such as depression and anxiety. Sleep disruption and oxygen desaturation during sleep can alter neurotransmitter levels in the brain, affecting mood-regulating pathways and contributing to emotional instability. Regular exercise is a powerful mood enhancer that promotes the release of endorphins, neurotransmitters responsible for feelings of happiness and well-being. Physical activity stimulates brain-derived neurotrophic factor, BDNF, a protein that supports the growth and maintenance of nerve cells, improving cognitive function and mood regulation. Engaging in aerobic exercise can alleviate symptoms of depression and anxiety associated with sleep apnea. Exercise helps reduce stress, boost self-esteem, and promote relaxation, improving mood and mental resilience. 7. Stress reduction. Chronic stress is both a cause and consequence of sleep apnea. The physiological and psychological stress response can trigger or exacerbate sleep apnea symptoms, leading to disrupted sleep patterns and increased daytime stress and fatigue. Sleep deprivation resulting from sleep apnea further exacerbates stress, creating a vicious cycle of sleep disturbance and heightened stress levels. Stress activates the sympathetic nervous system, releasing stress hormones like cortisol and adrenaline that can impair sleep quality and respiratory function. The resulting sleep fragmentation and oxygen desaturation can further contribute to stress and anxiety, perpetuating the cycle of sleep apnea symptoms. Exercise is a natural stress reducer that helps regulate stress hormones, promote relaxation, and improve coping mechanisms. Physical activity triggers the release of endorphins, which act as natural mood elevators and pain relievers, reducing stress and promoting emotional well-being. Engaging in regular exercise can help alleviate stress associated with sleep apnea. Exercise promotes mindfulness, enhances self-awareness, and fosters a sense of control over one's health, reducing the impact of stress on sleep quality and overall well-being. 8. Deeper sleep stages. Deep sleep, also known as slow wave or stage N3 sleep, is a critical stage of the sleep cycle that plays a vital role in physical and mental restoration. During deep sleep, the body undergoes essential processes such as tissue repair, growth hormone release, and memory consolidation. Deep sleep is crucial for physical recovery. Deep sleep promotes muscle repair, immune function, and growth hormone secretion, supporting overall physical health and vitality. Cognitive function. Deep sleep is essential for memory consolidation, learning, and emotional regulation. It enhances cognitive performance, attention span, and problem-solving abilities. Hormonal balance. Deep sleep regulates hormone levels, including cortisol, stress hormone, insulin, blood sugar regulator, and leptin-ghrelin, hunger hormones, influencing metabolism and appetite regulation. Individuals with sleep apnea often experience disruptions in deep sleep due to frequent arousals and respiratory events, which can impair these critical physiological processes. Exercise plays a significant role in promoting deeper sleep stages and enhancing overall sleep quality. Regular physical activity, especially aerobic exercise, has increased the duration and quality of deep sleep. Exercise helps regulate circadian rhythms, promote relaxation, and reduce sleep onset latency, time to fall asleep, leading to more efficient transitions through sleep stages. A study published in the journal Sleep Medicine Reviews demonstrated that individuals who engage in moderate intensity aerobic exercise experience more prolonged periods of deep sleep and improved sleep architecture than sedentary individuals. Incorporating exercise into your daily routine can optimize deep sleep stages and support overall health and well-being. 9. Boosted metabolism. Metabolism refers to the process by which the body converts food into energy and regulates essential physiological functions. Sleep is crucial in metabolic regulation, influencing energy expenditure, hormone balance, and nutrient utilization. Disruptions in sleep patterns, such as those seen in sleep apnea, can adversely affect metabolism and contribute to weight gain, insulin resistance, and metabolic disorders. Sleep deprivation and poor sleep quality alter hormone levels, including leptin, satiety hormone, and ghrelin, hunger hormone, leading to increased appetite and cravings for high-calorie foods. Chronic sleep disturbances can disrupt metabolic homeostasis, contributing to obesity and metabolic syndrome. Exercise and metabolic health. Regular exercise is a key strategy for boosting metabolism and improving metabolic health. Physical activity increases energy expenditure, promotes fat oxidation, and enhances insulin sensitivity, leading to more efficient glucose metabolism and weight management. Aerobic exercise, strength training, and high-intensity interval training, HIIT, have all been shown to positively influence metabolism by increasing muscle mass. Strength training builds lean muscle mass, which increases basal metabolic rate, BMR, and promotes calorie expenditure at rest. Enhancing insulin sensitivity. Exercise improves insulin sensitivity, allowing cells to effectively utilize glucose for energy and reducing the risk of insulin resistance and type 2 diabetes. Promoting fat loss. Aerobic exercise and HIIT promote fat oxidation and facilitate weight loss, reducing the risk of obesity-related metabolic disorders. 10. Improved lung capacity. Lung capacity refers to the volume of air the lungs can hold and the gas exchange efficiency during breathing. Sleep apnea, especially obstructive sleep apnea, OSA, can impair lung function and reduce lung capacity due to airway obstruction and oxygen desaturation during sleep. Exercise plays a crucial role in enhancing lung function and respiratory efficiency. Exercise and lung health. Regular aerobic exercise strengthens respiratory muscles and improves lung capacity by increasing lung ventilation. Aerobic activities such as running, cycling, and swimming increase tidal volume, air breathed in and out with each breath, enhancing lung ventilation and oxygen uptake. Strengthening respiratory muscles. Exercise targets respiratory muscles such as the diaphragm and intercostal muscles, improving their strength and endurance. Enhancing oxygen transport. Physical activity improves cardiovascular fitness, facilitating oxygen transport to tissues and organs, including the lungs. A study published in the European Respiratory Journal demonstrated that aerobic exercise training improves respiratory muscle strength and efficiency, leading to better oxygenation and respiratory function. Incorporating aerobic exercises and respiratory training into your exercise regimen can enhance lung capacity, reduce respiratory effort during sleep, and improve overall respiratory health. Here are the types of exercises beneficial for sleep apnea. Combining aerobic exercises, strength training, and specific breathing techniques can effectively target underlying factors contributing to sleep apnea. 1. Aerobic exercises: walking, cycling, swimming. Aerobic or cardiovascular exercises are beneficial for improving respiratory efficiency and cardiovascular health, essential for individuals with sleep apnea. Activities such as brisk walking, cycling, swimming, or dancing elevate heart rate and increase oxygen consumption, promoting weight loss and reducing the severity of sleep apnea symptoms. Aim for at least 150 minutes of moderate intensity aerobic exercise per week, spread across several days. Gradually increase the duration and intensity of workouts as fitness levels improve. 2. Strength training, resistance exercises. Resistance or strength training exercises target specific muscle groups, including the upper airway muscles, crucial in maintaining airway patency during sleep. Incorporate exercises such as push-ups, squats, lunges, and weightlifting to strengthen muscles throughout the body. Strengthening the muscles of the neck, throat, and tongue can help reduce the risk of airway collapse and improve overall muscle tone. Strength training exercises should be performed 2-3 times weekly, allowing adequate rest between sessions to facilitate muscle recovery and growth. 3. Yoga and breathing exercises. Yoga and specific breathing techniques can promote relaxation, reduce stress, and enhance respiratory function. Practices such as pranayama, breathing exercises, meditation, and gentle yoga poses can improve lung capacity, enhance oxygenation, and alleviate sleep apnea symptoms. Focus on deep breathing techniques that engage the diaphragm and promote abdominal breathing, which can help strengthen respiratory muscles and reduce airway resistance during sleep. Incorporate yoga and breathing exercises into your routine 2-3 times per week, either as standalone sessions or alongside other forms of exercise. Tips for starting an exercise routine. Starting and maintaining an exercise routine requires careful planning and consideration, especially for individuals with sleep apnea. Follow these tips to begin your exercise journey safely and effectively. 1. Consultation with a healthcare professional. Before starting any exercise program, consult your healthcare provider or sleep specialist, especially if you have underlying health conditions or concerns. Discuss your sleep apnea diagnosis and treatment plan, and inquire about specific exercise recommendations tailored to your needs and limitations. 2. Setting realistic goals. Set achievable and realistic fitness goals based on your current fitness level and overall health status. Start with manageable objectives, such as increasing your daily step count or committing to 20 minutes of exercise daily, and gradually progress over time. 3. Gradual progression and consistency. Begin with low-impact exercises and gradually increase intensity and duration as your fitness improves. Consistency is critical to reaping the benefits of exercise. Establish a regular exercise schedule and stick to it, aiming for at least 3-5 sessions per week. Listen to your body and adjust your exercise routine, especially if you experience discomfort or fatigue. We have come to the end of this video. Thank you for watching. If you found this video helpful, give it a thumbs up and leave a comment sharing your experiences with exercise and sleep. Remember, small lifestyle changes can lead to significant improvements in your health. Stay tuned for more informative videos, and we'll see you in the next one.